Hello everybody, my name is Nuri Shakya and this is my presentation for DEH455 for Mrs. Lisa Steiner's class. My topic is tobacco cessation, and these are the objectives that I've included in this presentation. The first one is description of the problem, which is tobacco cessation. The second one is the demographics involved. Then I have the applicable legislation. Then I have accessibility impacts. Then I have current plans to address the problem. I have also included the future directions, and I have included the proposal that I have prepared for the tobacco cessation, my proposal report, and lastly I have also included the references. According to the Centers of Disease Control and Prevention (CDC), tobacco use is the leading cause of preventable disease in the United States. It is critically important that the prevention and the cessation programs are available to help people break their tobacco addiction for good. Rates of cigarette smoking have declined in the recent years from 21% of adults aged from 18 or older in 2005 to 15% in 2015. However, higher tobacco use persists among certain subgroups of adults, including the adults with income below poverty, adults aged 25 to 44, and adults who lack a high school degree or have a GED. I have also attached a picture from National Centers of Health Research Center. It talks about the health benefits of quitting smoking. The points that you can see are better vision and brighter teeth, improved breathing and normalized risk for lung disease, decreased belly fat and risk for diabetes, stronger muscles and lower risk for bone fracture, increased dopamine production, heart disease risk drastically lessened, lower risk of cancer, faster healing time, and more responsive immune system. I thought like this visual was a very good one that I could have added to my PowerPoint. I have collected some tobacco facts about smoking and how it causes the health risk. Tobacco use affects every single organ in your human body, including heart and lungs as the most immediate danger, and also nervous system, similarly our eyes as well. Tobacco has shown to lead to cataracts, which is an eye condition deemed to be the number one cause of blindness in the world. The key facts are heart disease. Smokers have 2 to 4 times higher chance of suffering from a heart disease or having a stroke than a non-smoker. Both conditions can lead to serious complications and death. Lung cancer. Both men and women have 25 times higher chance of developing lung cancer as a result of smoking. Heart failure. Smoking causes your blood vessels to thicken. This makes it harder for your heart to pump out blood and can lead to deadly heart failure. The condition is noticeably even more among smokers who smoke less than 5 cigarettes a day. Blood clot. Since smoking greatly diminishes the blood circulation, there is a greater chance of clot forming. These clots can severely jeopardize your limbs and extremities and lead to amputations. Diabetics are particularly vulnerable to this group. Cancer. Tobacco use has been found to cause cancer in most major organs and systems in the human body, from cervix all the way up to the soft palate. Pregnancy. Smoking makes it difficult for women to get pregnant. It also increases the risk of preterm delivery, stillbirth, ectopic pregnancy, and SIDs, also known as crib death. Diabetes. Active smokers have a 40% chance of developing diabetes. In addition to that, active smoking makes it harder to control and manage the disease. Gum disease. Smoking leads to gum disease and can contribute to tooth loss. Few other facts collected from the CDC's National Youth Tobacco Survey: more than 31% of high school students in the United States use at least one tobacco product, which includes e-cigarettes. 12.4% of middle school students use at least one tobacco product, including the e-cigarettes. From 2017 to 2019, high school e-cigarettes use increased by 135%, and middle school e-cigarette use increased close to 212%, which is a lot. Smoking is number one preventable cause of death in the United States, which kills over 480,000 people per year. Secondhand smoke kills more than 41,000 people in the United States each year. There are 28 states and Washington, D.C. have passed the law making virtually all public places and workplaces, including restaurants and bars, smoke free. The District of Columbia has the highest cigarette tax in the country at $4.50 per pack. Each day, close to 1,600 kids under 18 try their first cigarette, and close to 200 kids become new regular smokers. Each day, close to 1,400 kids tried their first cigar. On average, more than 56 kids try their first cigar every hour in the United States, equaling about 493,000 every year. Massachusetts became the first state to prohibit the sale of all flavored tobacco products in 2019. My next slide is about the demographic affected by the use of tobacco products. It is no secret that quitting smoking significantly reduces the risk for a wide range of diseases and early death. Yet, tobacco use remains the leading cause of preventable death and disease in the United States. The good news is smoking rates have decreased over the past decade and are at historically low levels. In 2018, 13.7% of the adults smoked cigarettes. However, not all Americans are benefiting equally from this decline. Certain parts of the country and population continue to smoke at a higher rate, highlighting the uneven progress where we need to do a better job of preventing and reducing tobacco use. Here are the top 10 populations disproportionately affected by the cigarette smoking and tobacco use. The first one is adults that live in the rural areas, adults living in traditional tobacco growing states, military veterans, lesbian, gay, bisexual adults, adults that did not graduate high school, Americans making less than 20,000 per year, uninsured Americans, American Indian Alaskan Natives, Americans with 7 or more days per month of poor mental health, adults in public housing. Applicable legislation. In 2020, the U.S. Surgeon General released a new report entitled Smoking Cessation, a Report of Surgeon General. This report made a number of important conclusions about quitting smoking and the benefits of doing so. These included the insurance coverage that provided access to quit smoking treatments without barrier and other public policies such as increasing the price of cigarettes, adopting smoke-free policies, maintaining comprehensive statewide control program requiring graphic warning labels, and implementing mass media campaigns which are proven to increase the cessation rates. Back in 2019, in December, Congress approved and the President signed the legislation raising the tobacco sales age to 21 across the country. I have selected this picture because it gives us a clear idea about the access of cessation services all over the United States, and it gives the different grades A, B, C, D, F, and I. And I took this from the State of Tobacco Control 2020 website. So my next slide talks about current plans to address the tobacco use. I have four pointers that I have collected. State tobacco cessation coverage, tobacco prevention program funding, law to increase the tobacco sales age to 21, and technical assistance for effective tobacco cessation policies. I'm going to talk a little bit about each one of them. The first one, state tobacco cessation coverage. All health insurance programs funded and run by the federal government should cover a comprehensive tobacco cessation benefit such as Medicare, Medicaid, TRICARE, state health insurance market plans, and federal employees' health benefit programs. The second one is tobacco prevention program funding. The American Lung Association strongly supports funding state tobacco prevention and cessation programs at levels recommended by the CDC. Sustained investments in these vital public health programs over the long term will prevent thousands of illness and deaths from tobacco use and save billions of dollars in medical expenses. Number three is the law to increase the tobacco sales by age 21. The American Lung Association has advocated for the increase of the age for the sales of tobacco products from 18 to 21 because it will help save lives. In December 2019, the legislation was included in the federal year-end legislative package and passed by both houses of Congress. President Trump signed the bill into law on December 20th, 2019, and it immediately took effect. The fourth one I'm going to talk about is providing technical assistance for effective tobacco cessation policies. Tobacco cessation covers policies concern what treatments, health insurance plans, public like Medicaid or private like HMO, provide tobacco users who want to quit. Changing health systems like hospital, physician practices, health centers to support the tobacco cessation involves identifying patients as tobacco users and establishing a system to get them to help to quit. Next, I'm going to talk about the future direction. I had divided it into three parts: adolescent smoking prevention, second one is young adult smoking prevention, and the third one is adolescent and young adults nicotine dependence and tobacco cessation. So I'm going to talk about the first one, adolescent smoking prevention. Life skills training is designed for students in grades 6 through 9, approximately the age of 11 to 15 years old of children. And example objectives include saying no to tobacco, alcohol, and other drugs. This would develop a positive self image and making independent decisions without being influenced by peers, media, and others. The second one is the young adult smoking prevention. Data from the adolescent studies indicate that approximately one-third of the youth reported that they first tried their cigarette at work. Studies are needed to explore more factors that influence smoking initiation, heavy smoking, and quit behaviors among workers at risk for smoking and determine the association between smoking among young adults and social factors in the work environment. Third is about adolescent and young adults' nicotine dependence and tobacco cessation. Studies to Studies to date suggest that additional research is needed to examine nicotine dependence among youth and young adult smokers and develop an effective intervention to help them quit smoking. I have included the sample proposal that I have prepared for the week 6 discussion. This talks about the POAER process. The first one is problem, objective, actions, evaluations, and resources. The problem is use of tobacco products, smoking leading to oral cancer. Objective is the SCLC mission is to increase smoking cessation rates as well as the number and type of health professionals who help quit the smoking. Actions. The center creates partnership with a variety of groups and institutions to develop and implement programs for smoking cessation. Evaluation: a review committee led by SCLC will make decisions on which initial letters of intent will be chosen to submit full proposals and which proposals will be funded. Grant funding will be provided by the IGLC. Follow-up evaluation and technical assistance during the course of the grant period will be performed by SCLC. Resources: Pfizer's Independent Grants for Learning and Change, also known as IGLC, and Smoking Cessation Leadership Center, SCLC, at the University of California, San Francisco. More details about the sample proposal is attached here. And lastly, I have included the references that I used to make this presentation. Thank you for taking time to listen to my presentation and take a look. Thank you.